Okay, hello everyone. Thank you so much for dedicating your time to listen to our updates on restarting fertility treatment in Greece. This is the third webinar I'm dedicating on the COVID epidemic and the implications on fertility treatment. And I'm hoping that as things are getting better, we will stop doing those webinars and we'll stop using the COVID title. And of course, we will dedicate more time and effort into other more productive and perhaps more pleasant activities. So I will give you a very quick update for the first 20 minutes about the situation in Greece mainly. And then, of course, I would be free to take questions and comments. Now, coronavirus is here to stay for a little bit longer. How long more, we don't know. We're hoping not very long. But let's be prepared because it may well be a few months. I hope not more than a year, perhaps a year and a half. So the whole world now is affected. We all know that. I'm not going to go through the details about the virus because now you're all very familiar with it. I will focus on Greece and I will focus on how my country has managed to hit the headlines with a successful model of management. I mean, I did try to log on to the Johns Hopkins website this morning, but it was a little bit slow. However, I can share with you some data. I mean, as you're probably aware, there's about 4 million cases in the world. Sadly, there's more than 200,000 cases in the UK. And if I'm aware correctly, more than 31,000 deaths in the UK at the moment. And as you probably know, UK is now topping the adverse list of COVID effect in Europe, has exceeded the number of deaths in Italy, and is only second to the US in the world. Now, Greece has done a little bit differently, a little bit better in the short term at least, because of very early measures. I mean, Greece has been in lockdown for quite a few weeks before the UK and before most of European countries. We've just come out of the lockdown on the 4th of May, and thankfully I cannot share the screen with you at the moment, but thankfully the overall number of incidents in Greece has been less than 3,000, and we've only had 150 deaths so far. And this has been now widely known that it's been due to very, very strict and very early measures. So we are fortunate now to enjoy the benefits of an early ease of the lockdown. And of course, this has affected our medical practice. We've started as from the 4th of May, we have started seeing non-emergency cases, both as outpatients, and of course we have started treating our surgical patients and non-urgent cases, of course, following specific guidelines. So we are in a position where we see appointments, of course, with no accompanying persons, no children. We do ask them to complete the questionnaires, of course, to wear masks and have temperature measurements, hand washing, and social distancing. May I please ask you to mute your microphone so that we don't have background noise, if possible? Thank you. Just mute. You should have a mute button on the top left of your screens. Thank you. Thanks. Right. So the measures in Greece are very strict, and it seems that the public has followed those measures. Even now that the lockdown has been eased, you don't see very much traffic. You don't see very many people walking outside. Wearing a mask in a shop or in an office is absolutely obligatory, and there's fines in place in case you don't. And of course, the same applies with public transport. Now, there's a lot of guidelines as to the protection of staff. So there's a lot of staff protection measures in place, which include both questionnaires, temperature measurement, but also screening at regular intervals. And of course, our legal departments are very busy drafting and publicizing all the measures in terms of limiting the risks. Now, pregnancy, delivery, and breastfeeding, until now, thankfully, there's quite a few positive news with regards to that. So the Royal College of Gynecologists of London has published that the disease severity is matching the non-pregnant individuals. To my knowledge, there's no maternal deaths until now due to coronavirus, which is very, very promising. Of course, as you're probably aware, most of affected individuals are males and not females. So it seems that, you know, gender offers a little bit of protection to our patients, and the same applies in pregnancy. But of course, many pregnant women may be carriers of the virus with being asymptomatic with no symptoms, and they may be negative to the questionnaire. So we have to be very, very aware of that. Now in Greece, we have instituted that there's universal testing on anyone admitted to labor ward. And I think this has limited the number of undiagnosed cases going into labor, and of course has limited the potential harmful effect on the lady herself. As you're probably aware, women found to be positive on COVID are usually treated by cesarean section, managed by cesarean section, which is minimizing the potential effect of labor itself to the pregnant lady, and of course to the fetus and the staff. And of course, the born children are under absolute surveillance. So at the moment in Greece, if somebody is testing positive before labor, then they're managed in a specific manner in a specific facility. And it's absolutely obligatory that anyone admitted into labor undergoes very, very heavy screening, including the PCR testing. Now, with regards to vertical transmission, the feeling at the moment is that the scientific evidence is saying that there's perhaps low chance of this happening, but of course it cannot be ruled out completely. And until now, most neonates have been negative to COVID, and breastfeeding is encouraged with particular protection measures, of course. Now, there's a lot of question mark on the effect on the first trimester and the effect of fever overall on the fetus. And of course, more data is required on the overall effect of the COVID infection in pregnancy. Now, fertility care. Now, clinics are reopening in Greece. We were in talks with our societies and associations, and only yesterday the Greek HFEA, the Greek Fertilization and Embryology Authority equivalent, has issued the guidelines, which I will later on discuss. Now, good news is that fertility in IVF, there's no reports that SARS-CoV-2 is passed on to female or male reproductive organs. However, there was a report from China a few days ago that perhaps there may be some evidence of the virus in sperm. However, we're not exactly sure of what is the consequence of that. And of course, more studies are due to come out and give us more evidence. There's been a question mark as to whether people should defer pregnancy. As you're probably aware, we cannot defer. I think there's an estimation of 100 million pregnancies in the world, and of course, the vast majority of them will occur naturally, so we cannot push back humanity. So I think all we need is to understand a little bit more and have better ways to protect our pregnant ladies. And of course, there's a lot of psychological support that's required for both patients, siblings, partners, and staff during this epidemic. Now, the European Society of Human Reproduction, they have issued guidelines. Can I please ask you to mute your microphones, because there's a lot of background noise? Thank you. Now, the European Society of Human Reproduction has issued guidelines. In summary, there's a lot of evidence that our services, they need to be adapted, they need to change, they need to become more secure and more guarded for our patients and staff alike. And of course, we need to adapt our services into the new situation, and of course draft and have in place the code of conduct for both staff and patients. Now, this is the ESHRE guideline, and of course I will comment on that, what is the Greek situation at the moment, which is making it even more, in my opinion, more robust and more careful. Because what we have to be aware is that there's a lot of unknowns. So we'd rather be safe than sorry. And in Greece, we don't seem to have the luxury of being sorry, if you see what I mean. So this is the ESHRE guidance. So basically, questionnaire before IVF, before embarking on IVF, and during the IVF process, during the stimulation, and of course before the egg collection. So if the patient is asymptomatic and has no risks of being a carrier without knowing, then it's a green light. So ESHRE is saying include. If there's a question mark, or if there's possible symptoms and possible infection, then ESHRE suggests to perform the antibody test. And of course, if the antibody test is negative, then they can be included. And if it's positive, then of course they're excluded from treatment and they follow a different route in order to identify further, treat, and so forth, and perhaps cancel the treatment. Now, in Greece, this has become even more robust, and we had our guidance that came out yesterday. So we perform a triage before embarking on before even thinking on embarking on the cycle. So maybe about 2 weeks before stimulation. If this is negative, then people may be able to start the stimulation or preparation for frozen embryo transfer. And this is the time where it's required to perform not an antibody test, which as we all know, perhaps is not very sensitive and gives a lot of false negatives and false positives. So on embarking on IVF, on stimulation, it is strongly suggested to perform a PCR testing, a testing which is looking for the virus itself, the RNA of the virus itself. And only if this is negative, then women are allowed to continue their stimulation or to begin the stimulation. The rationale behind that is that by doing this, you ensure that you have healthy women and healthy people in your IVF clinic, and therefore you're reducing the chance of contaminating staff, contaminating the facility, and also starting a treatment that would have to be canceled later on. Because if somebody is asymptomatic on day 0 or day 1 of stimulation, and they are indeed positive to the virus, then they may develop symptoms later on day 4 or day 5 of stimulation. In the meantime, they may have infected other patients or staff. And of course, they may have been under treatment, which they would probably need to cancel afterwards. So this is the rationale. I'm not going to give you my personal opinion here, because I believe that we all have to comply to our national guidelines, because each country, they have the wise people, they have the scientists, and of course they make decisions based on the ergonomics, the economics, and the individualities of each country. So I will not comment on that. I think it's a little bit over the top, but I think safety first. And so far, Greece has proven to be right, and has proven that by taking extreme measures, we managed to keep the epidemic at bay with only 150 deaths. So, and again, if this is strongly suggested, the PCR testing on day 1 or day 0 of stimulation, the PCR, a second PCR testing is obligatory. It's compulsory on anyone who is going to be triggered. So before the egg collection and before the frozen embryo transfer, it is not strongly suggested. It's absolutely necessary. It's obligatory. It's our responsibility to have PCR testing before anyone is entering our theaters, before any genetic material is entering our labs. So we repeat that PCR testing on day 10, day 11, day 9 of stimulation, a couple of days before egg collection or embryo transfer. So this is the Greek guideline at the moment. And of course, if anybody is changing category during the course of stimulation, then of course they have an emergency PCR testing. Of course, this is producing a lot of anxiety, a lot of stress. The question is the PCR testing available? The answer is yes at the moment, it is available. Of course, there's questions about costs, questions about the reliability of tests and so forth. But it seems that this would give us the highest levels of safety at the moment for our patients primarily, and of course for the fellow patients and staff alike. Now, similarly, we have similar guidelines for staff, very, very strict questionnaire daily. We work in cyclical mode and so forth. And of course, if there's any suspicion, then testing will be performed. Most of IVF clinics, including our own, we are now looking into instituting routine staff testing at regular intervals to ensure that we're all healthy. Now, surgery, it is also law in Greece now that no one would undergo surgery without PCR testing beforehand. This is based on evidence that if someone is asymptomatic and they are carriers of the virus without knowing, and they undergo elective or any surgery involving general anesthetic, and that of course includes all gynae fertility surgery, hysteroscopies with an anesthetic, breast cancer surgery and so forth, they would be at highest risk of developing complications, lung, pulmonary complications, secondary to COVID and anesthetic, and of course they would infect patients and staff and facilities. So we perform no surgery without PCR testing at the moment, which is streamlined. It's performed within 48 hours prior to admission and so forth, on top of standard guidance on questionnaire. So this is the situation in Greece at the moment. This is my favorite slide. We have to save hope, not just save lives. And the hope of coming out of the epidemic is here. Until then, until we have more data, more evidence, we need to remain safe. In particular, in fertility care, we have to be extra careful in order to preserve the safety of the woman undergoing IVF treatment, the partner, her environment, and of course, the unborn children have the right to be healthy as well. Please keep posted with regards to more guidelines. Only last night, I mean, at Embryo Clinic, we have a department now of COVID, a COVID department, which is dealing with all the updated news on COVID implications in our fertility treatment, and that includes, of course, the care for our international patients. The Ministry of Tourism issued guidance yesterday that international flights will not be allowed until the 15th of June, although hotels are opening the 1st of June. It seems that in Greece now they're taking one step at a time because they don't want to backtrack at some stage, which is always the fear. So no international travel before the 15th of June. We hope this is not going to be put off even further, but you understand that they will be treated as potential risk, all the international patients. And some of you may have seen in the news that some sort of testing may be required for anyone traveling within 72 hours of taking that flight. So stay tuned. If we have any more news, we should share them with you. My standard advice to all our patients, international patients and local patients alike, is that take advantage of technology, keep in touch, drop us a line, ask questions or request Skypes in order to get ready for when more news are available, and of course for when you should be available to travel for either investigations and testing in the UK or treatment in Greece. We have now put in place some provisions in the north of England, in the Manchester and North Wales area. There is a possibility of performing some tests. So any of you interested in getting a little bit of action in place, please get in touch and we should be able to streamline you through our associates, mainly in the north of England, but also of course in the south, in London, southwest and so forth. So thank you so much for listening. We should keep having those updated webinars every couple of weeks or so, but in the meantime, if we have any breaking news, we should share them with you. Stay healthy, stay safe, and keep in touch. Thank you.
Thank you, Dr. Tsakos.
Oh, hello, Dave. Would you like to add anything, please?
I have a question, if you have time.
Absolutely, yes.
Thanks for a fantastic presentation and putting a lot of people's minds at rest. Do you feel as though you're at an advantage in Embryo Clinic because you are split over 3 floors when it comes to writing your social distancing policy?
Yes, absolutely. Yes, we are. And this is helping us keeping away from each other, because as you're aware, if there's an incident within the unit, then the unit has to close down. So we have taken a number of measures. Measure number 1 is that we have 2 teams of staff in 2 different floors. So we're using the general ops and gynae offices upstairs for routine scanning with a special team. So we have a team upstairs. We have a separate team on downstairs. And of course, we do a lot of consulting now on the 3rd floor, which is the administration floor. On top of that, we now have 2 shifts spread mornings and evenings, trying to accommodate the spreading of the appointments. We only accept a very small number of appointments at any given time in order to respect the social distancing. I mean, I don't very often wear my shirt these days, but I'm on my own now on the 5th floor. There's no one else, absolutely no one else. So I think it's a safe environment for me to have no masks and no uniforms. Now, the second point I would like to raise here is that patients are triaged. Patients are in very close contact with us. So if we have any suspicion, we know about this well before they arrive into the unit. And as you know, we have facilities in our private clinics in a different facility to Embryo Clinic outside this building, where we can consult patients and we can do scannings. Now, on top of that, we have now been linked with two IVF units within the city. So we have emergency plans in place in case there's any positive case within Embryo Clinic. So we have contracts and links with 2 clinics within 10-minute drive of Embryo Clinic in case we need to do some emergency treatment in another IVF facility.
Thank you, Dr. Tsakos. That's great. That's very reassuring.
Thank you, Dave. Any other questions? Hi, Laura. Hi, Richard. Right. Okay. Now, can I say a little bit more about traveling? We don't really know when it's going to be safe to travel. I mean, we have booked some initial appointments. I think initial appointments can be safely done from 15th of June onwards. There's a lot of thoughts that tourism will open in Greece, because it seems that Greece is probably the safest place to visit or to holiday in after the lockdown in the UK. And it seems that our countries have amazing amazing sort of relationships in order to build a protocol, a safe protocol for people wishing to travel for both holiday and medical care. However, let's keep in touch because it depends on the type of treatment one is after and depends on how we can follow the guidelines if you wish to split the treatment between the UK and Greece. So for example, if our authorities are requiring a definite test before starting with stimulation, and if this is not available in the UK, or if it is available at a very high cost, then of course that's an issue that has to be discussed. So we've always been individualized, but this is the time where we need to be even more individualized. All our staff are here, they're present, they are healthy. So please don't hesitate to share your concerns and worries with regards to that. And of course, accommodation-wise, the hotels are opening. I mean, city hotels are opening within Thessaloniki, are opening on the 1st of June. So this is not, there's no backtracking in that. So this is going to happen. So I think in terms of accommodation, it's going to be widely available on the 15th of June when flights are free. Okay. How many days before hysteroscopy does the patient need to have the PCR test? 2 days, within 48 hours. I mean, we have a protocol now in place with associated. There's a bit of echoing. So yeah, if you mute your microphones, please. Yeah. So within Greece, we have associated labs all over the place. So if somebody is needing PCR testing, they are asked to contact us. So we refer them to a lab near their home. If they are within 1 hour from Thessaloniki, then we ask them to come in a day before the hysteroscopy, early in the morning. They have the PCR test, and then they have the hysteroscopy performed the following day. I mean, basically, we need to ensure that anyone who's going, you know, if you have a snuffle, or if you've been in contact with a COVID patient, or if you're, you know, whatever, suspicious of having COVID, is not a problem because you have a COVID test and we find out. The big issue at the moment are the asymptomatic patients, are the patients who have no symptoms and they are carriers of COVID. They are the big challenge for scientists. I mean, equally, as you're aware, I mean, I think fertility patients and surgical patients overall, they're very familiar with infective screen. And I mean, you're aware that fertility patients, for example, they need to be free of infectious disease within 6 months of fertility treatment. So HIV, hepatitis B, hepatitis C, and syphilis, we screen for anyway. I think fertility patients are aware of screening. And also surgical patients, as you're probably aware, no one goes into theater without being tested on the day or on the previous day for infections. So, I mean, we treat COVID testing as an extra infection screen. I mean, it's nothing more and nothing less than that. The complexity is that the test is now very expensive. I mean, at the moment is, I'm not sure of the price, but I think it's about 150 to 200 pounds maybe. But thankfully, the prices are falling every week. And we are now in discussion with our government to be able to have sponsored tests, as we do have in Greece. As you know, Greek government is sponsoring the thalassemia test. That's why it's inexpensive, because thalassemia is so common in Mediterranean countries. So my hope and wish is that in the next few weeks, the next few months, COVID PCR testing and antibody testing will be fairly inexpensive, and we will be part of the routine testing as we do for anyone undergoing a medical procedure. Okay. Any questions, please? I'm available.
Just wanted to ask about travel still. On the 15th, will it still be the case that if you turn up at Greece, you'd have to be isolated for 14 days? Is that right? Or
The answer is I don't know, but the official announcement made yesterday was that from the 15th, and there's going to be guidance hopefully in the next few weeks, that from the 15th of June onwards, there will be free travel, and that was the Ministry of Tourism of Greece that made the announcement. Free travel within European Union, and there's some sort of medical testing required in order to travel. So either antibody testing or PCR testing within 72 hours of travel. That was the announcement made yesterday. And also there was a comment about airport seats that it doesn't seem to be feasible to have like 1/3 of passengers or half of passengers. I don't think there will be restrictions on how many passengers on the flight. And of course, provided that everybody is wearing a mask and so forth, and everybody is tested. That was yesterday's announcement, but stay tuned, and if we have more data, we will post all of that on our social media and of course website.
Thank you.
Are you able to carry out antibody or just a PCR test? David and Karen, in Greece, PCR test. PCR test is our scientific boards in the ministry have decided that at the moment, PCR test is the most reliable means of ensuring that somebody is COVID-free at the time of fertility treatment or medical intervention, PCR testing. Okay, any other questions, please? Now, we could have a session. I mean, I have to share with you that as a doctor and, my team here, we have now created, sorry, you have to mute someone. Yeah, we have now a working group screening through the evidence every day and trying to identify anything that's relevant to our practice. And we're trying to, of course, empower ourselves initially with knowledge and, of course, then our patients. So there's a lot of questions and discussions about testing. I mean, as you probably know, there's two schools. The school of saying that test, and the other school of claiming that a bad test is worse than no test. So I don't think the scientific community have reached an agreement yet. And of course, there's always a matter of availability and what's available. As you probably know, the tests are becoming available now. Most countries are trying to secure the availability and the kits for the nationals and for their own country. So there's a lot of question marks, a lot of gray zones and all that. But it seems that every week tests are getting better, more approachable in terms of price and more feasible in terms of logistics. So stay tuned and we will share any information that comes through. At the moment in Greece, PCR testing seems to be the gold standard. Okay, does the test needs to be done upon arrival at Greece or before departing to Greece? As I said before, it seems that you won't be able to travel. You won't be able to board the plane without some sort of testing. So you probably need to have some sort of testing within 72 hours of traveling, according to yesterday's guidance. And depending on what kind of test you've had, I mean, as you probably know, at Embryo Clinic, we accept, and every clinic has their own guidelines. I mean, at Embryo Clinic, we accept all the UK tests, so you don't have to repeat them. So if you've had a test before flying out and that qualifies for the initial test, that's fine. And then we will just perform the test before the procedure, just one test. And of course, another big issue, which hasn't been resolved yet, I would expect that maybe in the next few weeks we will have more guidance on that, is whether we should test the male partners and the males before they produce sperm. And how should we test them, and by means of which test? At the moment, the guideline in Greece does not include testing the males. However, with new evidence arising, And of course, if the evidence shows that it is likely or it is possible or it is risky that an asymptomatic male may have infected sperm with COVID, then we may find ourselves in a situation in which we would need to test males as well before they produce the sample. At the moment, this is not a requirement in Greece. Did you say that PCR should be done 72 hours before a flight? I said that some sort of testing should be done within 72 hours of flight. Whether it's a PCR or antibody, that has to be between governments and between airlines. I would expect a guideline to come out in the next couple of weeks. If the male partner is traveling, would it not be good practice to test the male partner too? It would be obligatory in order to fly in the first place. So if a male has been tested to fly, that would be, of course, an extra bonus for us. It would be a nice one to know. With testing, the main issue, of course, to tackle is reliability of the test and cost, and the combination of the two. So what I'm saying, I think it's unlikely that the very strict guideline of Greece will be followed by other European countries. I don't think, for example, I expect that the general guideline of ESHRE will probably be the norm in Europe. And the general guideline is not as strict as the Greek guideline. But I think Greece is trying to secure at the moment the very good performance of safety in the COVID pandemic. So they don't want to risk having a huge second wave. And as you probably know, medical interventions and medical facilities may be areas in which the virus can spread very quickly and very badly. So my impression is that I think it's unlikely that the UK, for example, or Germany or Belgium or Spain would require anything more than the ESHRE guideline is requiring. But the ESHRE guideline, it seems that by having a questionnaire without any form of testing, they would probably miss maybe, I don't know, 5%, 2%, but a good number of asymptomatic patients who may have adverse effect of undergoing IVF whilst being carriers of the virus without knowing. And it's not just being under IVF treatment, it's of course embarking on a pregnancy whilst being carriers of the virus. And of course, all of this will become evidence in the next few weeks. Do you have a new consent form for COVID? Of course, absolutely, yes. Yes, we do, yeah. Our legal departments are very busy drafting, updating, and re-updating almost daily the consent forms. It's not so much of a consent as it is of an information initially of all the knowns and the unknowns of the COVID effect on pregnancy, not just fertility, but on pregnancy. And of course, there's a lot of new data that all our patients should be aware of. So absolutely, yeah, we have created and should be available for our patients going through treatment now. We do have a new folder, the new COVID folder available for patients. If the male has traveled, would they be tested pre-treatment, collection, transfer at the same time as the female? Answer is, according to our national Greek guideline at the moment, the answer is no. They will not have official viral testing. However, they will be tested via the questionnaire and of course temperature and all that. So, but no official testing according to yesterday's guidance. Okay. So I think we've answered most of your questions. Let me summarize by saying that at this stage, we'd rather be very safe than sorry, that each country will have their own guidelines, please respect your country's guidelines. Your country's authorities know better than you do, as our country's authorities know better than we do. We have to comply with the guidelines. They have the responsibility for our safety and quality. Greece has very strict guidelines because of all the reasons I mentioned. Until now, we have very good faith to our leaders, both scientific and political leaders, because by default, they managed to keep a very low impact of the epidemic on Greece. We've only had 150 deaths. To my knowledge, the 80 or 90% have been of very high risk groups. So we have very strict guidelines. Of course, we will support our patients to navigate through the challenges of having treatment in Greece, both international and national patients alike. Please follow the simple rules. Keep healthy. Look after your habits, your smoking, your alcohol, your weight. Keep healthy mentally as well and spiritually. And we are committed to support you in any possible way, because we're also very much aware of the amazing psychological impact of the COVID epidemic on anyone. And fertility patients are a vulnerable group. They are, they're heavily involved with treatment, most of them. They've done tests that may become invalid in a few weeks, in a few months. There's a lot of uncertainties. But please keep asking. We have an amazing network in the UK. Of course, you all know Dave Gibbon, who's always available. Dave is an amazing volunteer. Thank you so much for all you've been doing for our patients all over the world, in particular, of course, our UK patients. We have Liz Hughes, who is another volunteer and a very proud member of Fertility Network UK in North Wales, who can support you as part of the Fertility Network commitment. Of course, so we have Shona Gilbert, who's a Fertility Network responsible person in Manchester. And of course, a lot of other people who I wouldn't like to mention. We have Karen Ansell, who is supporting and helping all the North Wales patients. We have amazing doctors all over the UK, in the north of England, in the south, in London, southwest, and so forth. So keep in touch. Thank you for listening in. We're here to support, we're here to help, and I hope we will stop doing COVID webinars very soon, and we'll be doing other kinds of webinars, but the connection will stay healthy and stay tuned. Thank you so much.